for 15 and a half months as of today. 457 days I've been a carnivore. And 5.5 weeks ago, I had kidney failure, stage 5. So I have a special guest with me on the show today, and we're going to talk a little bit about it. Hello, everyone. My name is Frederick Brown with Hanging with the Browns. I'm here by myself solo today. My better half is not here. She's sitting in the background working the cameras for me. So let's go ahead and bring my special guest in. We have Laura Russell. Hi,
Hello.
Laura. Some of you may know Laura. She's a dear friend of ours, and she's qualified to do this. So Laura, let's jump right in. I'm going to talk a little bit about what happened to me. But first, can you kind of give us your background and why you're qualified to even talk about my medical
Sure.
history?
Yeah. So part of what qualifies me is because I did keto for 28 years and carnivore for over 5. So I've worked with a lot of people that started out having kidney failure and we've reversed it doing this way of this lifestyle. The other thing is I've been a nurse now over 22 years, and I have dealt with every aspect of the body, every body system. Now, my favorite is hearts, just because of family history. But I always talk about the human body in terms that men can understand, because most of my patients in the cardiac were men. So I would always talk about how important the heart is and how it's like a master cylinder and a distributor cap. It's electrical, but it's a pump. And then the kidneys are your filters. They also produce something called erythropoietin, which starts the red blood cells. So they're very important. There's lots of things that they do. The adrenals sit on top of there. So that is kind of where I come from, knowing and understanding the lingo and the laboratory results is where my background is.
Awesome, thank you. So about mm, 5 weeks ago now, I had what was called an acute kidney injury. It was rhabdomyolysis, rhabdo, however you pronounce it. It's an acute kidney injury. And for me, it came from me sitting in hot water for extended periods of time. Now, this wasn't something that just happened one time. I've been doing this for years. And I think, over a period of time, it probably caught up with me and resulted in rhabdo. And I actually, when I went to the doctor, I got blood work done and also had some blood work done over the next 3 weeks, which I'm going to share with you guys. And we're going to let Laura explain some of the numbers and talk about what was happening to my kidneys and why it happened and what we need to do to make sure it doesn't happen again and whether or not I'm recovering properly. So I think that's the most important thing. I do want to show some numbers. I had shown some numbers in part 2 of this, but I have a qualified person here now to help explain some of these numbers for some of the naysayers and people that you know might not believe that this is a real thing, and it is a real thing. So, Laura, let's talk about. Can you talk about rhabdomyolysis and tell us a little bit about it?
Sure. Yeah. So most people in the medical field, rhabdomyolysis, most of the time that we see that it is a crushing injury. The cells get crushed. It could be from burns, like in a physical fire, and it can be from extensive heat. So, like your outside workers, your welders, people that do lots of saunas, and then like yourself, somebody who spends an extensive amount of time in hot water where I don't think you just set in that water, you continually added hot water to it
Yeah,
to keep it where you kind of could tell it was warm for you. So that causes the rupture of our cells. And when those cells rupture, you spill out everything inside of them. And so most of the components of the cell are small and can be filtered by the kidneys. Potassium does not really break down small enough. There's other components that don't break down. The muscle cells that break, those stay larger and then they can't get in through the filter. So then they clog up that filter, which can elevate your blood pressure or it can release aldactone and drop your blood pressure, which I think is what happened to you. And that's because also in that heat, you cause your vessels to relax and open up, and that allows that blood to move through so much easier. So you can see nausea, vomiting, diarrhea, seizures. Um, you can pass out. You can completely lose consciousness. You can die. Your heart can stop, because you need the right ratio of potassium, magnesium, calcium, and sodium in your bloodstream for the heart to work. Because, like I said, it's kind of like a distributor cap and it needs those electrolytes. So when you spill those out into your system, you can get really rapid heartbeat. And some people get the opposite. They get really low depending on which one of those electrolytes they have the most of in their system. So that is pretty much in a nutshell what rhabdomyolysis is. And you can pronounce, I just say rhabdo, that's easiest.
Yeah, it is. Okay,
Mhm.
so let's do this. Let's bring in some of my numbers. I want to pull
Sure.
up some of my numbers, and if you can talk about um the blood tests that are shown here. I do have some highlighted in red. So can you kind of give us a rundown? I'm showing
Sure.
July 30th at 12 noon on my first, and then 3 weeks later on 8/21. So if you can kind of go through this and identify which
Sure.
ones kind of relate to the kidneys and tell us what you see going
Yeah.
on here.
So the top one doesn't per se run with the kidneys. It's what caused the kidney failure. So that is that CK. So that's creatinine kinase. So that is muscle protein breakdown. That is like those larger cells I said that have trouble getting to and through the kidneys. One of the cells that when they rupture. So that number that you had is, like I said before, I've never seen anybody anywhere near that high. I had somebody years ago that was probably 4,000, I'd say 4,000 less than that. I've never seen that high. But that is ultimately what caused the actual acute kidney injury. Next is the creatinine, and that's how you're clearing, these impurities. That's telling you that you're filtering well of the creatinine. BUN is your blood, urea, and nitrogen, and that's also some waste products. Urea, stuff like that, has a little bit to do with the liver as well, but that's byproducts and breakdown products that you're supposed to get rid of and filter through the kidneys. So all of that was high. Your AST, your ALT were your liver numbers. They were up there. It's not to a scary range. And then the GFR is the glomerular filtration rate, and that's the little filters that are inside the kidneys. That's kind of where that whole process happens. So all of those things showed, and then of course your PSA and everything's going to be high because of all of this stuff not filtering out like it's supposed to. Causes inflammation in all of those areas, acute inflammation. So that just shows, like when you see this, this is definitely, the person would look and say this is acute kidney injury and hopefully not chronic. Chronic kidney injury is years and years and years of having higher numbers. Where even though I think you had some damage that you were doing a little bit over time, I think it built up until it just finally was too much and your kidney said, that's it. Which is where when I talked to G that first day, I said that's acute kidney injury. That's because she said he has CKD 5, and I said, well, he's got kidney disease stage 5, but I wouldn't call it chronic. But they wouldn't know that looking at at your numbers. So that's basically what those numbers kind of represent.
Yeah, they didn't say CKD. They said
Okay.
AKI. So yeah, they never said
Okay.
CKD.
Okay.
Um, okay, but from looking at the numbers, what is your professional interpretation of the trend? I mean, are they trending
Oh
um,
yeah. Mhm.
adequately, or
App.
you know?
They're trending way better than I expected them to, because the 2 people I've had 3 patients I physically took care of with this condition. 2 of them, they did, return to normal, but it took them many, many months, and I'm talking several months, but they did the standard American diet.
Okay.
So I believe that really hampered their progress. Where yours, I would have never expected your CK to go down that fast at all. So when you guys sent me that first one and I could see that trending down so fast like that, um, I wasn't surprised, but it was a good I just was like, wow. But just because knowing how eating protein helps the body heal, you know, I kind of would expect it to have went down. But and I'm also medically trained to where when G said, well, how long do you think it's going to be? I was like, I didn't wanna say, "Well, it could be 3 or 4 weeks." I haven't seen it take that long. I've seen it take a lot longer, but I always wanna give it could be out this far, it could take this long. It could take a few months, which I did expect it to take a few months versus, 6, 8 months like it does somebody else to see the numbers, but you're already well under where I would have expected you to be, like, completely. I mean, when you go back and see the doctors, I can't imagine that they're not gonna be like, "This is just absolute crazy world," because like your CK now at 290, which I'm sure it's less than that now, and they really want that one under 200. Um, the rest of your numbers, everything is trending in the right direction. So it's not like we see, compilation of some stuff going down, some stuff's not. It all systematically looks like it is improving.
Right. Great. Great. Now, I know we kind of briefly talked about, and I said this in the beginning, that I am carnivore and been carnivore for 15 months. And I want people out there to know that this is real. I mean, it's anecdotal, but it's
Yep.
my story, and I believe that most of us can have the same kind of results. So, if you're having some issues, you need to really consider ketovore, or carnivore as a way of helping your body mend. And I truly believe that because of it, I'm able to sit here before you right now. So, Laura, let's talk a little bit about some of the after effects of going through this kind of injury. Because one of the things that I had noticed, that even before I left the hospital, I began having pain in my foot and my ankle, and it got progressively worse. And then by the time I got home, it got to the point where I could hardly walk. And it was, I guess, gout or crystals settling in my toes and my knees. Um, so, can you talk a little bit about that? What was happening there? I guess as part of the healing process.
Sure. So whenever you have that bad of an acute kidney injury, you can get a condition which is called ascites, which you did have. So it's these pockets of fluid around the abdomen. Sometimes it's the entire abdomen that you'll see. And that's because those byproducts that we're trying to get rid of can't filter out. So then they leach out into your tissues. You start breaking down your own protein and albumin. So that is what I think that abdomen swelling that you even had at home before you actually went. I believe that that's what that was from. Um, as for like the joint pains, it could be that the uric acid was building up because it couldn't be filtered out. So, and some people have higher uric acid levels just naturally. It doesn't, diet does matter, but there are people who do have higher incidences of uric acid, but the kidneys and everything normally filter that and get rid of it. So when those are damaged, and you got to think about all these kidneys have these tiny little openings to filter, and now they're just inflamed. So, if you get an injury and you get swelling, that's what you had inside the kidneys. And then all the structures around that as well. The liver's mad, everything's mad, the prostate's mad, everything. I'd be surprised if your cortisol and everything wasn't off too because of having all that swelling in that area and all those impurities just sitting around there marinating all of your organs. Um, but then any place that you've ever had an injury, of course, when that uric acid level goes up, or even if it's just plain Jane inflammation from all of this, that's exactly where that's going to go. It's going to go to path of least resistance where there's been an injury or an issue before. So that is what I think happened with you. I think that's why you had that. And I do think that will, over time, that will continue to improve. Um, there are some things that you can do. Um, I have somebody right now that has really high uric acid. It's a female, and she's not carnivore or keto. She's regular, and she's doing the tart cherry juice that's sugar free. And then she's doing my dandelion tincture in her tea or her coffee every morning because that's a diuretic and it kind of helps clear out the kidneys and stuff. So there are some things that you can do when you get this, if you get this condition, it is something that you have to go to the hospital for, when it gets to that bad of a level, because it does require, you to have IV hydration. You have to get the right kind of fluids going into the body that can get into the cells that aren't ruptured, because the ones that are ruptured, they're just done. So those are going to be filtered out eventually.
So even the ruptured, I guess they're called nephrons, or nephrons.
Yeah, then
Can they
yeah,
rebuild?
your nephron. Yeah, oh, absolutely, and you're on exactly the diet you need to be to get those rebuilt. We can rebuild every single thing inside of our body, which, in 1980, if you'd told a doctor that you needed a liver transplant and you just needed a lobe of somebody's liver, they'd have called you crazy and said, "Nope, we have to do a full liver transplant." They didn't realize that you can take a piece of that liver and put it in somebody else, and that yours will grow to fit you, and the person that donated, they will regrow that lobe. So we can heal our body if we're not putting in a bunch of toxins and blocking signals and allowing things to work the way really God intended our bodies to work. We are supposed to be able to heal. And, food is supposed to be the medicine. Socrates said that many, many moons ago. So, but yes, nephrons, everything. I mean, neurons, nephrons, skin tissue, brain, eye tissue, everything can be rebuilt. Um, so yes. Oh boy.
Since this has
You've
happened, yeah, since this has
yeah.
happened, I've been looking at a lot of YouTube, a lot of doctors, and as a matter of fact, I was looking at a nephrologist today, and one of the things I do recall Dr. Ken Berry saying is that you really got to pay attention to your source, right? So even though she was a
Yes.
nephrologist, right, she was more vegan leaning. So everything that she recommended was plant based, and
Mm,
I'm thinking, and I know, I believe that plants
yeah.
are medicine, and I do believe there's some
Yeah.
truth to it. But then there
Yeah.
the other effects that plants will have on my body, right?
Right.
The inflammation and the
Oxalate.
oxalates, yeah. So those kinds of things, I guess you kind of weigh them, and you really, it's hard to discern what should and shouldn't we believe on the internet. And I
Yeah.
believe that if you believe in the carnivore diet, just stick with it, and it'll all work itself out.
Sure, sure. And I mean, which this surprised me completely. I was so happy when G said that, you guys had a physician who was looking at you and was like, you know, thank God you were doing this carnivore lifestyle, because if you had not, I think all of us pretty much know where you would be.
Right.
Um, so I mean, he at least he must know enough about carnivore. He must have looked up some information to know that as to what the healing aspects. And really, the sad thing is every single physician, every single nurse, every single PA, nurse practitioner, if they just go back to before they had the last so many years of training, which was all about stuff and pills, it's all about disease management. It's never about curing the person anymore. It's just how long can we keep you on the government Medicaid, medicines and going to the doctors all the time. Is if they just go back to physiology, it just makes sense that eating meat, you get all of these amino acids, which is what you build your body with. So anybody to think that eating like this would not help your body rebuild, they didn't pay attention or somebody did their homework for them in physiology class
Yeah.
because it's
Yeah.
there, you know.
Yeah. Do we have any questions for Laura or me? If you do, please get some comments. All right. Lost my baby brother earlier this year with kidney and liver failure, but it was alcohol related. All the symptoms are familiar. Okay. Yeah.
Absolutely,
Sorry.
yeah. With alcoholism, you get fatty liver disease, which is what we're seeing in children now, at such a young age. It used to be a disease that didn't hit anybody until they were in their 60s or 70s. It was alcoholic related. But now our children are showing up with this 10, 12, 13, 14 years old. Um, wanting a don't get a jacuzzi.
Yeah.
Oh my gosh. Yeah. Get a pool.
Yeah.
Get
Get
a
a pool.
pool.
Yeah.
Yeah, and it's not that you can't do time in the jacuzzi. Hey, Russ. It's just that you have to not you're not a lobster. I know I say that to you all the time, but I'm like, you are not a lobster. You just cannot and should not be in there for that amount of time, that kind of heat. So, like G says, when you go to a hotel, when you're traveling, it's got a timer on it. Well, there's a reason it's got a timer. So, getting up and turning it back and getting back in and adding more hot water is probably not the best thing for you.
Yeah, I'm a little gun shy right now. I don't want to do a lot of things, and
Yeah,
I think what's really important to me is that I heal internally, and that's what I want to do. So no hot tubs, no saunas, none of that. I don't even want to get in a pool. Even my shower water is kind of lukewarm. I'm afraid of hot
that's
water
okay.
right
And that
now.
And really, one of the things that you can do that really helps is taking a normal shower and then the last 30 seconds, not ice cold. You don't want to throw your body into shock, but definitely much cooler water the last 30 seconds to kind of reset everything. That's a good thing to do as well. That's just good for the body. So that's something that you could do.
Put that one up. Yeah, Russ
Right.
made a comment here. I saw Russ right after I got out of the hospital August 1st. The second G and I went down to Orlando, and Russ was there, and down in Quito, Orlando, and
Yeah.
he got to see me. Stomach swollen. I couldn't walk, or I don't even think I think I left my cane in the car. So my mobility was pretty much zero, and so he got to see me, and he said it looked like what 12 rounds, 10 rounds with Mike Tyson. And I was looking pretty bad. I was looking pretty bad, feeling pretty bad, but I had to go there anyway to see you guys. But
Yeah. So the question is, so this has been what, 4 weeks, 5 weeks?
it's 5 weeks and 5 days now,
Okay,
almost
okay.
almost 6 weeks.
So how much do you feel like what do you say is your percentage of how much better you feel now compared to what happened on that day, that last day?
Oh, I feel so much better now. However, I am, as I mentioned to you before we got on, I'm having a bout again with more inflammation. I had another flare up, but I think I know the source, and because I've been taking in a lot of electrolytes, I know stevia and I don't quite get along, and I think that's been the cause because everything else has been meat and water. So, and the stevia is the only thing that's been a little bit out of place. So, I'm pretty sure that's what's causing my flare up right now. And it has subsided a little, but it was last night. I had a hard time getting in bed. Had a hard time just moving around, lifting that knee, and it's still swollen. But here's an interesting thing, Laura, and I've said this many times to my wife. I said, some of what I'm going through now, I actually went through when I was a kid. And
Mm.
the doctors at Duke, nowhere could identify what was going on with me. And I guess because I was so young, they didn't do any blood tests to see what was going on with my kidneys. But they said I would grow out of it. I mean, I've had this inflammation in my knees for many, many years. And when I started the carnivore diet over a year ago, it all went away. And I haven't had it for a long time. This last reoccurrence has been primarily because of the rhabdo as well as the element.
stevia.
So
Yeah,
it's sugar for me, and my body doesn't know the difference between artificial sugar and real sugar. It gets
yeah,
processed the same, and it's bad news for me.
yeah, and there's a lot of us out there like that. I'm also the same way. I really cannot do any of those, which is why I stay lion diet, is because that is exactly how I feel my best. Every once in a while, I'll tiptoe and like take a bite of like my salsa that I make that I can, and then I pay for it for a week. My nose is full, and that's the majority of my issues. I don't. The only time I get joint pain is if I decide to buy a bag of pork rinds, and even a little bag. If I eat a bag of pork rinds the next day, I wake up and I can't even open my hands or close them like that. I mean, they're just full of inflammation. So it's just part of what some of us have to do, which, you know, I'm okay with eating ribeye and hamburger every day. I don't care.
Right, right.
The
I am too.
the
I am too. If it makes me feel better, and I do. And the fact is, I don't have to worry about what I'm gonna eat. I know what I'm gonna eat. Just go make
Exactly.
it and be
That's
done
what
with
I tell people 'cause I've had, clients that are like, "Well, I won't know what to cook," and I'm like, "You don't even have to think about it anymore." I said, "When I did keto," and I had a channel for keto that I did keto cooking, and I could make you a cheesecake that looked and tasted just like a regular cheesecake. But my god, it was like 4 hours in the kitchen, which I promise you Russ would never have made because he hates being in the kitchen for any length of times.
it.
But, any, and that's probably when like I said, the last 2 years of keto, I was 26 years, and then they started doing the keto treats and all those sweetened bars that had, like, stevia and monk fruit and stuff like that, which they do come from a natural source. I have a stevia plant. Well, I did. My husband killed it. It was in the garden, but he, tilled it under accidentally, which is fine. But, but I just can't use that stuff. It's the same with, a lot of the stuff that's in the garden. It's just stuff I can't do, so
Question for you, Laura. Do you believe stevia flavored drinks can raise A1C?
I believe so what your A1C actually is showing is that is glycation of onto your hemoglobin, okay? It's part of your red blood cell. It's a piece of the red blood cell that carries the oxygen. So I don't know that I have seen where stevia or any of the sugar alcohols will bump up your A1C, but I can tell you this, it's a possibility because I have the keto mojo and I used to do like my ketone levels and my blood glucose. And when I was keto, and if I ate like one of those Quest bars that had like the stevia or the monk fruit in it, my blood sugar would spike. It just my body saw it as sugar. So my guess is if it if your body reacts to that, then sure, I think you could absolutely see that. I will tell you, I've seen people's hemoglobin A1C go up on this way of eating that don't do any of that stuff, that eat like the lion diet. And they're like, how's that happening? Well, because our red blood cells live a lot longer than the people who are eating the standard American diet, but that test is set up to see every 90 days. And so if ours are living way past 90 days, which they are, then we have more cells because the new ones are being born. We have a bigger amount of them to be glycated. So there's some other tests that you can run that are like glycated albumin is one. There's another one that Dr. Berry was talking about last week. I didn't write it down, but there's another one that you can test to see if that's more accurate. But the other thing with these sweeteners that you have to be careful of, it's so important. Our health is so intertwined with our stomachs. But when you take in a lot of sugar alcohols, it kills off bacteria. So that's why I use the xylitol in my tooth powders because it kills the bacteria in the mouth. The way it does that is bacteria sees it as a energy source. It loves sugar and it goes to it, but it's a sugar alcohol and it can't use it. And so those bacteria die off. Well, that's good if you're spraying like a xylitol nasal spray in your sinuses to kill the bacteria there. but you don't want to kill all the bacteria in the gut because you have good and bad. So I think a lot of people have dysbiosis, which is just their gut gets, dysregulated from having too much of that in there. But I know a lot of people are able to have that too. So, it's just a trial and error. N equals one experiment. You have to try it and see what works for you. G can have jalapenos. I'd love to have a jalapeno, but I just cannot have one. But every time she talks about it, I'm like, gosh, I remember what those taste like with the cream cheese inside of them. And but it's just something I just know I cannot do.
Yeah.
Woo!
Well, Laura, I really want to thank you and I appreciate you taking the
Sure.
time to come on and kind of help uh, provide some understanding of what I was going through, and thank you for looking at the numbers, and folks, you can go back and take a look at the numbers and see how they're trending in the right direction. I do have an updated test that I did on this past Friday. Unfortunately, I haven't received the
Thursday.
results. Haven't received the results yet, and hopefully I'll get it by tomorrow. And if they are significantly more improved than what they were 2 weeks ago, we'll come back and we'll show those numbers as well. I'm excited. And for those of you that are not subscribed to Laura's channel, she's a wealth of knowledge, y'all. She's one of my favorites. She is. And I appreciate you, Laura.
You're
So
you're
uh,
welcome.
yeah, at
Yep,
at
Renee
healthy at healthy
at
carnivore.
Healthy Carnivore.
At
Yep,
healthy
yep.
carnivore.
And Renee's question there, yes, donating blood could help with that. I used to donate blood a lot, and but the last 3 times that I did it, they literally, like, put the needle in and dug and dug and dug, and I was like, "Forget it. If you can't do better than that, I'm not gonna be somebody's pincushion." But yes, that would help for sure. Same if you have hemochromatosis where your iron's high, that's another thing, that you can do is you can donate blood. So that would be another thing that you could also do. All right.
All right, guys. So we appreciate it. If you got any questions, go ahead and you watch the replay. We'll go back and look, and we'll try and get those answered. But please watch the video first.
Yeah.
you know,
Yes.
yeah,
Good
watch the video
information.
first. Yeah, yeah. So thanks again, Laura, guys.
You're welcome.
All right.